Today our topic is about joint needling and acupuncture. So what are the difference between them? And because again, last time we talked about Western acupuncture and Eastern acupuncture, right? They basically no different is because acupuncture has the Eastern medicine theory in there. So what about joint needling? Now, I'm sure you heard a lot of joint needling, right? And what is really joint needling is, okay, we're going to talk about this topic today. And do we perform joint needling? Who else do joint needling? And who do acupuncture? This is the topic for today. Now, if you're here, please give me a thumbs up and share this live video. All right. And then I'm going to my Instagram, and if you're on Instagram, please say hi to me and leave the comment down there. If you're on YouTube, please give me a thumbs up and subscribe to my channel, and remember to ring the bell. Right. So, okay, joint needling. Now, you heard a lot from who? From physiotherapists, chiropractor, osteopath. I'm pretty sure that you heard more from physiotherapists, right? Oops, this is stopping. I don't know what's going on. Let's do it again. Oh, hang on. I'm sorry about it. I'm just trying to figure out my okay, my Instagram. It didn't work. Okay, it's working now. Right. Yes, you definitely heard a lot of joint needling, this word, from physiotherapists. And some physiotherapists, they're actually doing Western acupuncture, which we mentioned about last time. And the time before, I don't know when, probably last week. Then joint needling, a lot of people perform it now. So what is really joint needling? Have you ever heard about trigger point? Trigger point theory. Yes, I'm pretty sure you have, because when your physiotherapy or your acupuncturist or your massage therapies, and when they find a knot in your body, they go through it, when they massage you and they find a point, there's a knot in here, then they tell you, hey, this is the trigger point. This is the trigger point, right? So they release the trigger point, and what happens is, oh, pain under here will go. That pain in here is gone. So the point in here, it can release pain in here or here. Or the pain over here, it can release pain up here or pain low in your lower back. So trigger point is one point that's very tight, very tender. Because of this point, tight and tender, and once you release it, and the pain in your upper back or in your lower back disappear. Right. Based on this theory, then you find a trigger point, you needle it. Instead of using your hand, you use your acupuncture needle. The needle is exactly the same as acupuncture. Exactly the same as acupuncture. You heard me right. Exactly the same as acupuncture. Now you know what joint needling is. Then I want to tell you, joint needling only used for muscular pain conditions. Again, when it comes to Western acupuncture, they use the acupuncture point that has been exists already, the same as what we do the point for muscular pain, for the local pain. And we, as an acupuncturist, we use the point not just for the pain for the leg, we can use the point for the organs. Okay. The organs. Okay. Now, trigger point is for the pain. and as well as any pain that actually refer to other part, right? If let's say we say, well, the point over here, trigger point here, pain will refer up here, lower down there, right? You release the point either using your fingers or acupuncture needle, then it can release those pain. Now, why call it joint? Now you know the theory. Now, why call it joint needling? Because compare with the needle, injection needles. Injection needle. Now, most people think about, if you're not familiar for acupuncture, and when we talk about acupuncture and they say, what is acupuncture? Oh, we're using needles. Oh, needle, and they're very scared. Why is that? Because the first idea they get is the needle they get from doctor, from the nurse in the hospital or in the clinic, in your GP, from your GP, because they use injection needles. Injection, they inject the fluid, inject something into your body. It is wet. So compared to the wet needle, injection needle, and when we do acupuncture needle, this is dry. So they create a name. Injection needle is wet needle. This acupuncture needle is dry needle. So they call it dry needling, right? That's where they get the name from, and based on trigger point. Now, I'll tell you, trigger point acupuncture has been there for long time. So there is no difference between trigger point acupuncture and dry needling. That's the idea, right? The reason they want to change to dry needling, because when they change to dry needling, it can take away from, it is not related to acupuncture. So they will create a new name for the same thing. Does it make sense to you? Now, how do I know that? Because I didn't know what dry needling is. So I went and attended dry needling workshop. I went to two people. One is from Australia, David Lee, and he's an osteopath as well as an acupuncturist. Now, he been studying 30 years ago. He been in practice for about 30 years. Now, way back there, he used trigger point theory and using acupuncture. Now, when he told me that when the dry needling came out, and he said, well, this is just purely acupuncture. It is just purely acupuncture. Do you know that? So there is no difference with acupuncture because he's been using it for 30 years. And that's where he learned from. So which means dry needling theory is based on trigger point theory, and trigger point theory is already in acupuncture theory. We use it too. Right? Just letting you know that. So so what is different? If you come to us, we do dry needling, we know trigger point theory, we have the chart. If you come to clinic, yes, you can see it. The chart is in the wall. Okay. Then what is the difference between the real acupuncture and dry needling? Dry needling only treat pain, but the real acupuncture, the traditional acupuncture can treat the organs, which means if we're performing acupuncture for you, we are not just treating the pain, we are treating the organ function. So we balance the organ function. We try to get the organ function again. So when the organ function again, then the pain will disappear. So it doesn't make sense, does it? Why, when we treat the organs, pain will disappear? Because when we treat the pain, we treat the organs, and the muscle will become stronger. Why is that? Where's the theory? Theory is in here. Stomach and spleen control muscle strength. control muscle strength, right? So stomach and spleen control muscle strength. As you can see over here. Where did I get the theory from? It's a classic Chinese medicine book. Therefore, when we treat structure imbalance, we have a structure imbalance technique, which you may be able to use trigger point. But we use GE acupuncture. Pretty similar to trigger point theory, dry needling, but it's much better, and we only needle one side rather than two sides. So when I say that is, if patient have pain in here and here, with dry needling, you'll find the trigger point in here, needle it, as well as the trigger point in here and needling. But for GE acupuncture, when we treat the structure, patient have pain in here and here, we look at the leak, is look at what's the imbalances. We can use the needle to treat the legs, or on your one side, or the hips, or the back and one side. Never put needle on the same point on both sides. That is the big difference between GE acupuncture and trigger point theory and dry needling. I hope that makes sense to you. So this is structure acupuncture. Apart from that, structure acupuncture is trying to, and trigger point is trying to loosen up the tight point. Why do we want to loosen up relax the tight point? Because when the tight point like this, it grab you very tight, and that one is like this. Which one will be less blood flow? Of course, that one, because it grab it very tight. So we need to loosen it up, make it balanced as the other muscle. Therefore, when the blood flow of both sides are great, then you will experience relief from the pain. Right? That's the theory. Then this is the structure. Now, why do we need to treat the organs? Because when we perform acupuncture, we try to increase the energy, which is the qi, and blood flow. So because without blood flow, nothing will heal. You won't get relief from the pain. Then if there is not enough blood, how do we do that? Now we need to treat the organs, because all the meridian that you can see from here, we call it stomach meridian, spleen meridian, heart meridian, and stomach meridian, for example, and spleen meridian. The blood flow on the meridian is from those two organs. Now, we need to make sure your stomach and spleen organs are function properly. Otherwise, if you just treat it with dry needling or GE acupuncture, structure acupuncture, it doesn't work as well in some cases or in most cases. Why is that? Because if the stomach are very weak, you may find that when you receive acupuncture doesn't work very well, or it got worse, or it works, but the next morning the pain came back, return very fast, or even worse. That's because you have lack of the function in your organs. So restoring the organs function is important in acupuncture practice. Now, I want to share with you this because a lot of people come to me and they say they have been to acupuncture, they have tried acupuncture, but they're really saying that it's just dry needling rather than acupuncture. So I spend a lot of time to educate my patient. That's why it made me want to do this video on my clinic page to let you know what is the difference between dry needling and acupuncture. Yes, we do dry needling as well as the real acupuncture, the traditional acupuncture. If you are in Hamilton, our clinic is in Dinsdale, so in New Zealand, call us on 078467956, 078467956. Now, we're not just treating the pain conditions, we are treating internal disease. We help our patient actually cut down medication. What I say medication, not just painkiller. If you have high blood pressure, diabetes patient, high cholesterol, we actually help you to cut down all those medication, slowly cut down, eventually stop all the medication. This is what we are expectancy, what we doing great for, and we are so proud of we can do that for you. So do come to us if you need any help. Now, for practitioner, please check the link down there. So we have Acupuncture 123 balance method, acupuncture local balance. That's online course, and I hope that you can learn from the basic and then move up to global balance. Then you'll be able to learn how to actually treat the organs to help your patient get rid of to be healthy again, rather than just treating the pain, right? Treating the conditions, treat the root of the body rather than just treat the symptom. All right. Stay awesome, and I love you all. Thank you for supporting. I'll see you tomorrow. Bye bye.